Okay, so for Autism Awareness Month, I wanted to make a series of videos that I'm just going to keep on my profile with some of my most asked questions about autism. The first one that I get asked a lot is about how we knew Ethan had autism. Ethan, he had a lot of problems from the very beginning. We struggled a lot with health issues, with behavioral issues. Because of that, I didn't really think about autism for a while because I just assumed everything was related to him being sick. He was born, I had a complicated pregnancy with him, and then when he was born, for the first few weeks, he was really great, slept a lot. And then just around the 2-week mark, it's just like a light switch went off and he just became really, really hard to soothe. He stopped sleeping, he stopped eating. Well, no, he didn't stop eating. He ate like crazy. He couldn't stop eating. And he just seemed to be in pain all the time and we didn't really know what was wrong. So we took him to a bunch of doctors. They weren't really able to figure it out. They just kept saying it was colic, and I just thought, I just feel like there's got to be something more. And so we finally, after a lot of trial and error and different doctors, we were able to figure out that he had a milk protein allergy, which is pretty common in babies. They usually outgrow it. He hasn't quite outgrown his yet. I don't know, there might be some true allergy in it or just intolerance. If he drinks milk, if he has a little bit of cheese and pizza or something, he's fine. But if he drinks milk, he'll get blood in his stool still. So he still has that. But in addition to that, he had silent reflux, which can be really, really hard on their esophagus. And it was burning a hole in it. And then he also had these stomach spasms because he was born early. He had an immature digestive system, and so it would just start digesting food randomly when he wasn't even having food in his belly, and it would always happen around a certain time, I guess. So the doctor gave us some medicine for that. That really helped. We didn't find out all those things at once, and so it was really a trial and error because we didn't really know what it was. So he was always a fussy baby, and he got a lot of ear infections. I guess severe reflux can really make you get a lot of ear infections. And so at 9 months, we were hesitant to do it so young, but we did a tube surgery for him. And then he caught a staph infection from the place. He got MRSA, which is really dangerous. But he just had a lot of different things wrong with him, and we really struggle with sleep training him because if he's in pain, we're not going to let him cry it out. So he just, there's some good moments and some happy moments, but it was hard to distinguish what was pain and what was behavior. He did, one thing I did notice is you know how when you're changing your baby, or if, any small baby, you're kind of play games with them, you're changing their diaper and you're talking to them, tickling them. And I remember with Ethan, he didn't react at all. And I just felt so stupid because I'd be oh, you're so good boy. And he'd just be and he didn't smile really until he was a lot older. But once again, I thought that was because he was in pain. I did have a harder time playing games with him. I remember thinking I remember with Audrey feeling more connected, and I thought maybe it was my postpartum depression. I didn't really know what was going on, but he had pre-speech noises around a year, but then around 18 months, he got really bad tantrums. He'd always had a bad temper where he would be drinking his bottle and he wouldn't have enough patience to finish it, to even get it from the bottom of the bottle to the nipple, because he would be too frustrated. So he'd stop drinking before it'd even get there. So we always called him 0 to 60 because he got mad so easily, but it just started getting a lot worse. These tantrums that would last for hours, and they were awful. And he would self-harm. He'd end up with little cuts on his forehead from banging it so many times, and we just didn't really know how to help him. And the speech worried us a bit because he had pre-speech, and then it just kind of stopped. So I had thought one time oh, I wonder if it's autism. Then I'm no, I don't think so. And I kind of put that thought away, but we called early intervention because we just wanted to know how to deal with him. We wanted to just have a behavioral therapist come and teach us how to parent him better, to understand why he was doing what he was doing. But we also, we were going to ask about speech too while we were getting him assessed. and they said they were very concerned about his behavior, that it wasn't typical of his age, the intensity of it. And that kind of surprised me because I thought, maybe it was a little bit worse, but I kind of thought maybe I was also like overreacting. And like she mentioned, like, I don't think she said the words autism, but she kind of implied it. I thought, oh, I wonder. And I took a screener online, and he had like the signs, but also young, it's hard to know. Like, he was only 18 months. And then Eric got the job in Ohio, so we moved. And so we weren't able to finish up with the early intervention. So after we'd been here a month or two, his behavior just was getting worse and worse. And I thought it's possible that it could be partly the move, but like maybe this is a story we'll all laugh about someday, or maybe it really is something. So I talked to my pediatrician about it, and she was like, yeah, those are all red flags. So I'll get you in with a developmental pediatrician. And so we got that appointment, but we weren't actually able to get in. So then we saw like a pre person for that. And she's like, well, it's about an 18-month wait to get tested. We're just like, okay, well, in the meantime, they're like, well, in the meantime, we can do some of these services. We get tested with, what's it called? The early intervention. But they didn't have really many hours for him at all for speech or OT. And so he's getting some, but it wasn't a whole lot. So we were kind of worried about waiting that long because he did seem to have so many issues with just getting through daily living that we were really concerned about having to wait that long. So I was talking to one of the early intervention people, and she's like, have you tried calling another developmental pediatrician? It's like, oh, no, I hadn't even thought about that. So I called one about 40 minutes south, and she wasn't seeing any new patients. So I Googled developmental pediatrician. I thought, okay, well, I'll drive to wherever I need. And I found one that doesn't take insurance. Like, you have to bill it separately. So I thought, I wonder if that will help their schedule to be more clear. If they don't bill insurance, maybe not as many people go. And he was a reputable doctor. He had like this program that they use in the state of Ohio for early intervention in autism. So I thought, he's credible. And so I called, and they're like, we can get him in 6 weeks. And so I thought, okay, that's not better than 18 months. And then 2 weeks later, we got a call, and they're like, actually, we got a cancellation. We can see him in a week. So we were really, really lucky. So we went to the appointment, and, he played with them. We talked for like 2 hours. And, at the end, he's just like, yeah, he's classic autism. Like, right now, it's hard to say where he is on the spectrum because he's so young. But he said he would place him at mild to moderate. And now as he's gotten older, it's more apparent that he's more moderate to severe. So we got that diagnosis. We got the diagnosis from the school district so we could qualify for the early intervention services. So until he was 3, we did the early intervention through the school district, along with he was able to there's another waiting list for speech and OT, and he was able to get in weekly with that, but it just wasn't enough. It really was just not enough hours. And so when he turned 3, he qualifies for the autism scholarship they have in Ohio, where if you choose to forego private, or if you choose to forego the public school system, they will pay up to a certain amount towards your private services. And we're also really lucky because we have good insurance that covers it up to 75%. So then the autism scholarship covers the rest. So now he's in an ABA program, which is play-based. ABA is short for Applied Behavior Analysis. And it's play-based, and so he plays, and they teach him living skills. He has his occupational therapy and speech therapy there, and they work it in with the sessions. And so he gets a lot of therapy. I mean, he did. It's, everything's crazy with coronavirus, but he's getting them through the phone right now. I mean, not as much, but it's something. So he does that. But yeah, so he was just a little shy of 2 when he got his diagnosis. I mean, it was more obvious for us because he was more severe. I think a lot of people get down on themselves because they don't know, and so they don't get the diagnosis till later. But it's hard, especially if your child does have speech. You don't think autism, even though a lot of children with autism have speech. We've been really lucky in the way that Ethan is such a classic autism case. He's so stereotypical that it's been really easy to get services. But It's not always that way. So a psychiatrist can diagnose autism, and so can a developmental pediatrician. And then they have the ADOS test, which is a 2.5-hour test that they administer. And you don't have to be a pediatrician to administer it. A lot of people are trained in it, and that can diagnose autism as well. There's never enough people, and so they're always trying to train more people to be able to administer the tests. And I know psychologists can administer it, and other like behavioral analyst people can. So it's always a long wait. That's the biggest fight, is trying to get that quicker, the diagnosis. It can be really frustrating. So we were lucky in a lot of ways. We're very, very blessed. But yeah, I think, you know, a lot of the time when we're getting him tested, some days we feel really stupid because we're like, he's not even acting weird at all. Not weird, but like, he wasn't acting atypical. And we're like, oh, are we just crazy? And then like the next day he'd be totally like tantrum, like wouldn't look us in the eye, like all these things. And some days we're convinced that we just look like idiots. Other days we're like, he totally has it. No one's gonna like think you're dumb or stupid because you get your child tested and screened. You can wait and see, yeah, but like, what if they do have something? And then, you know, you could have been getting services for a while, or you could have gotten on a wait list for a while. There's just no, like, there's no reason to wait. As long as you can get tested. There are some places that do wait to test, I think, till 2. So if you can get tested before then and you have concerns, do it. It's just, it's better to know, you know? So that is how we knew Ethan had autism. The signs of autism, there's a screener online, but you can just Google. If you ever have any questions, there's just screeners online. You can look at it and it'll kind of tell you if their symptoms are in line with autism or not. So that is how we knew. Everyone's story is very different though. So that's that.